My name is Dr. Luciano Lanfranchi. I'm a specialist plastic surgeon and I work in Kindcare Medical Center. Today I will talk to you about two topics that I selected for you. The first one is plastic surgery and aging, particularly the face. In the last years, plastic surgery tends to keep on developing towards what I define mini-invasive procedures and medical treatments. So we have lots of them available that we can use to treat aging faces. You know that with the passing of the time, our face tends to we tend to find soft tissue weaknesses. And certain shadows that we didn't used to have tend to arise, particularly in nasolabial folds, which is this area, and the marionette lines, which are the most important one and the most hated one, let's say. From the cosmetic treatments, the medical ones, we have a large variety of procedures that we can do, from the fillers, hyaluronic acid, which is the best one, till we can use also the Botox to correct dynamic wrinkles, particularly in the forehead and the periocular area. And we also have, for example, the adipose tissue, but just talking about mini-invasive treatments, but surgical ones, which can be done under local anesthesia, and it's, let's say, a natural filler. That means we remove fat from one part of our body which we don't like. It could be the tummy, it could be the inner part of the thighs and everything. We centrifugate it, we purified it, and we correct these shadows. We tend to lift up the zygomatic area and other areas of our skin, obtaining two types of benefits. The first one is the volume that we get, and the second one is that we purify, we increase the quality of our skin, because in each cc of adipose tissue that we will implant after centrifugation and purification, we have a large number of multipotential cells that will stimulate the cell regeneration, and it will increase the quality of the skin and the color of the skin. We also have to treat, for example, we have the opportunity to treat, for example, the marionette lines, particularly from 35 to 55 years old. We have also the threads, which are fantastic, because they are this kind of threads, barbed ones, that they are placed just under the skin, and they will tract up the skin and everything, creating two benefits. The first one is it will lift up the soft tissue, and the second one means it will create a fibrosis that will stimulate, and it will, let's say, yes, it will stimulate, it will allow this tissue retraction to last longer, creating an internal fibrosis and improving also the quality of the skin, because it biostimulates too. Let's say the last chance we have, and in certain kind of cases, we have also the facelifting. The facelifting, in that case, it's a surgical procedure. Excellent one. It has to be done at the right moment and with the right technique. That is, it is not a question of removing just the excess of the skin, but also to lift up all the deep part of our face. That is the fascia that covers our muscles. In that case, we'll do a big work is done underneath your skin, even if you only see a little scar just before the ear and everything. But in that case, it has to be done with a certain technique, as I was saying, but working a lot in the deeper part of the tissues. Why? To obtain a better result and a long-lasting one. The second topic I was going to talk about is always talking about adipose tissue. In this case, you know, obesity is always a problem, and local fat pads are cosmetic problems. But sometimes, and above all, when we talk about obesity, we talk about also about functional problems. You can imagine what that means. I mean, if you are, I mean, those people who are overweight have lots of people with a lot of problems with ambulations, with deambulation, with skin infections, with I mean, they suffer from back pain if they have, for example, for the female, big breasts and everything. So the first thing to take into account and to be aware of is that they have to eat well, they have to try to reduce their weight. If they cannot with a diet, they can undergo bariatric surgery, that is reduce the volume of the stomach in different ways. And after that, there will be an important weight loss. So in that case, they suffer from skin excess that can create also functional problems. That's why in those cases post-bariatric surgery is indicated. Post-bariatric surgery means, above all, the tummy tuck, where lots of skin and adipose tissue are removed, and that will improve the patient's deambulation. And the second one is, for example, the breast reduction, which causes lots of local skin infections and also back pain and everything. Those are major surgical treatments, but they are more than cosmetics. Cosmetic, they are functional ones, because we not only correct the cosmetic aspect of our patient, but we also, and above all, we reduce these functional problems. It is different, for example, after the pregnancy. Pregnancy, generally, when there is an important increase on the weight of the future mother, in this case, they could have abdominal wall problems. That is, the rectus abdominis, the abdominal wall, in this case, the abdominal wall, tends to retract, okay, creating hernias or important muscle diastasis. In that case, it is not only, people notice, the patients notice that after they deliver, their tummy tuck changes, and changes because of two reasons: because of skin laxity, and because in certain cases also that abdominal wall dysfunction, when the muscles tend to separate and they don't come back again after the delivery, they don't come, and they don't, and they are different, and they tend to be different, and generally with hernias all over the abdomen. In that case, it is possible to remove also skin and fat tissue excess, but also to repair the abdominal wall, which is really something important. We will not only give a beautiful aspect to the tummy tuck, just when you look in the lateral, from a lateral point of view, but just from a frontal one, because the hips tend to change, the abdominal walls tends to remain better shaped. Okay, it's not only a question of removing excess, fat tissue and skin. And in those cases, it is very important. The main aim is to try to prevent. That is, before, during, and after the pregnancy. It is very important not to do enormous efforts. It would be fantastic to everybody to exercise and to have a good diet, and above all, during the pregnancy, try to, let's say, using the elastic binders and everything, try to compact, let's say, the abdomen at the right way, so as to preserve this muscular abdominal function. after the surgery it is very important, and also after the delivery it is very important to look after their abdomens. Why? Because in that case, using the binder at the right moment, I mean, always being checked by professionals. It is very important because it will reduce the risk of muscular diastasis in that case. Always looking at the pelvic area, which is very important, and it has to be kept and looked after. So that's why the main message in these cases, also for pregnancy and obesity and the topics we talked before, in this case, the main aim and the main message I would like to say is that everything has to be done at the right moment. We have to prevent, we can prevent aging, we can prevent obesity and all the other problems that we talked about before. The most important thing is to go to the right professionals that use the latest technologies and materials, that they work with safety, and the right clinics and hospitals. Shukran.